chiropractic office. Come on in. So my name is Dr. Eric Huntington. I want to invite you into my practice. This is our reception area. You can see we have lots of seats for lots of patients in the office. We like that. And then, I don't know, what else do we have in the reception area? Okay, right over here we have one of our success story binder. Lots of success stories, we like that. Patients getting better. So let's go check out another area of the office. Come on. All right, so welcome to one of our administrative rooms. This is actually our billing office and also the office of our executive director. Behind me, we have our company organizing board. Basically what that is it breaks the company down into the different divisions and the different duties that different people have in the office, and shows our staff who does what, who's responsible for what on a given day. So really helps to suppress a lot of the confusion that I used to have in practice on a day-to-day basis. And then actually right over here is our information center. That's a new patient calling in, I'm sure. So in our information center, it's basically all the key statistics that we keep in the clinic, and they're graphed out over a number of weeks or a number of months, depending on how that statistic is kept. Everything from new contacts in the community to new patients in the office, to patient visits, to success stories, to patients that are finishing their treatment plan and happy with care. Everything that we graph, statusizing graph, is up here and up to date so that we can use these statistics in order to predict what we need to do in the future to keep the office expanding and growing. So now that we're done with the dry stuff, let's head out here and check out what's going on in the next room. As we head down this way, we've got consultation rooms. There's one over here, there's one just behind you, there's another one here, there's a fourth consultation room here. We often have many new patients in the office at one time, and a couple of report of findings happening at the same time. That's why we have 4 consultation rooms. And then here, the office opens up into one of our adjusting suites. And right over here, which I'll show you in a moment, we're going to be taking a look at our marketing center. So come on in. So this is one of our adjusting suites. One of the doctors that works here in the clinic works out of this area. He's got the 2 tables along with a view box, plenty of seats here for patients to sit who are waiting for their adjustments. And of course, this is where the magic happens, the chiropractic magic, that is. This is the whole reason why the rest of the office is set up the way it is, to support what happens right here. You know, this is where the patients are getting better, and this is why we all do what we do. All right, well, this is it. I'm not sure what you were hoping to see, but an office that does 100+ new patients a week, it all happens. It starts right here. This is actually our marketing department. We have 3 staff that work out of this area. You can see one desk over there in the corner, another one here in the corner, and then there's a 3rd desk right here behind me. And they've all got telephones. There's a few computers in here. I guess the thing to know and understand about chiropractic marketing is the fact that it's not the props, it's not the technology, it's getting out there and meeting people and letting them know what we do, and that's what our training's all about with the Chiropractic Business Academy. All my staff are trained. They're trained on our courses, the marketing course in particular, so you know they know what to do. All right, so you probably saw this huge tower here as you were coming down the hallway. This is our tower of forms, and it's dry and as boring as this actually is. It's just a bunch of pieces of paper. It's actually, I'm really proud of what's on that paper. All the data that I learned in the courses that I now teach through the Chiropractic Business Academy helped us to figure out how to run this office. It's all down on paper, but it's top secret. So you'd have to join us in order to see what's on these forms. Now we're going to head out to the main therapy and another treatment area. Come on this way. Check this out. Every chiropractic office has got to have this, I think. Every one of mine does. We call it the change of the month. When we get a really nice structural change on x-ray. This actually was a 10-year-old patient who had asthma, and she also had some body pain. So we took care of her. Not only did her asthma go away, it's according to her mother, but she's feeling better, and you can see the structural change here. Absolutely no curve here in her neck. She had a straight neck when she started. This is actually only after 4 weeks of care. Almost a normal lordosis, normal curve. So that's the kind of products we like to get here. If you take a look out here, this is the rest of the office. We do different therapies out here. It's about 2,800 square feet, this half of the office. We've got an exam area over here. We've got our doctor stations over here, and there's another adjusting suite over there in the corner. And then the rest of this open space is used for different therapies that we provide here in the office. I hope you've enjoyed getting a tour of the office here. I hope we get a chance to meet in person someday, but for now I gotta head to lunch, which means you gotta head on out of here. Adios.